Hi, I'm Dr. Dan Vogl from the University of Pennsylvania in Philadelphia. I'm here at the 2021 American Society of Hematology annual meeting. And one of the things I'm excited about this annual meeting is research that I'm presenting on behalf of a group of investigators looking at a completely brand new medication for treating multiple myeloma that has the difficult to pronounce name Modakafusp Alfa, also previously known as TAK 573. And Modakafusp is a really interesting molecule because it's an anti-CD38 antibody, very much like daratumumab or isatuximab. But instead of just being a regular antibody, it actually has tagged onto the end of it two interferon molecules. And interferon is a human hormone that was tried back in the 1990s as a treatment for multiple myeloma. It turns out it probably worked, but it also caused a lot of side effects. So the initial idea for this molecule is that by targeting the interferon directly to the myeloma cells, we could see the benefits of interferon therapy without most of its side effects. And I think we've seen that come true in the research that we're presenting today. We took patients who were relapsed and refractory, had been through a lot of prior myeloma treatments. In fact, all but one of them had previously gotten one of the CD38 antibodies, daratumumab or isatuximab, and gave them this medicine, Modakafusp, as an intravenous infusion every 4 weeks. And in this group of 29 patients, we saw that 38% had a response, meaning that we saw their myeloma shrink by at least half. And that's very exciting for a drug that has previously not ever been tried in patients with multiple myeloma. We're also excited because we're seeing some evidence that in addition to binding to the myeloma cells and delivering the interferon to the myeloma cells, we see that this molecule can also bind to other cells that have the target CD38 on them, which includes a lot of immune cells like T cells and NK cells. And it turns out that interferon can stimulate those cells so that in addition to targeting and killing multiple myeloma cells, this drug can have a stimulatory effect on the immune system. And we think that its effectiveness against the myeloma is probably a combination of a direct attack on the myeloma cells and a simultaneous stimulation of an immune effect that can also attack the myeloma. We're hoping that this turns out to be a real treatment option for patients moving forward, and Takeda, which is manufacturing and developing the drug, is planning a phase 2 trial that's going to start accrual sometime in the coming months, randomizing patients to a lower or higher dose of Modakafusp so that we can figure out which is the best dose to use going forward. And we're hoping that that trial also confirms the exciting results that we're presenting today.